have such a great admiration for Gunnar as a professor, as a manager, and as a defensor, as we all know of the science of the unique system of work and at the public university, a person that has developed sees that with development. It's such a great pleasure to be here with her. Also to compliment Mother Del Poi and Marcio Del Poro, Paulo Henrique, and I would like to compliment everyone here. Eduardo, who is our boss at the general and the assistants of the NSP. The school, which is also my school. I'm vice president, but I am a professor at that school. And so this is such a relevant topic for girls. It is such an important moment, and I would like to give some emphasis in the Brics and in the pharmaceutical policies. Fucurus has such a great position in the global world position, and this is a specific area for technological, scientific medications and medical systems. These are all topics that are extremely important for us. We are living in a world moment which is very complex and very challenging, very difficult, besides the things that afflict us, considering wars and etc. So we got a situation in the world, and some people present some data presenting some improvement, but actually this symmetries also only increase the problems, and they show very deeply in the health area, which is an important, the key one for international one. So in the medication areas, I would say that this is the max point that we see in terms of the inequalities in sorts of innovations and production and concentration that there is in the industries, and that they are big industries with a great complexity in this vast market, and also in the access for the pharmaceutical health assistance. Of course, this requires some national political and development and investments. Also, some investments national one for fostering medications. The public one, also the private one, where there is with the regulation of the state, and also states for some access to pharmaceuticals that are in a wider range of medications. We have a lot of pride in our systems in Brazil. We give us a lot of fight, a lot of work, and although we have a lot of contradictions considering this, it is something very heavy in this area. It is one of the contradictions that we gotta face, and we got people from all over the world with different health systems, and one problem that is common in this area is like struggle in this area. So to fight that, we have to have some national policies, and we believe that Brazil has a very expressive one. Farmacêuticas, for example, where we have medication in the country, and one of the producers 2 years ago we were the most important producers considering the industries in the countries, and we have some state capacity of production. We have to articulate more with some countries on the Brics. This is an articulation so that we can have a rearrangement that is geopolitical considering this area, and considering also the universal political access, the right that we have to that right access, and the medication. So I wish I will not be able to stay here all the time, but on behalf of you girls, I would like to thank this seminar that we can have a political research that is very right. So I would like to give you a big hug and thank you all for coming. We're gonna listen now the medical Mario Del Pos from UERJ. Good morning. I would like to compliment the panel here with Nato. I would like to welcome my colleagues, the researchers, people that come from other countries, from other institutions. I would like to say hello to Paulo for the leadership, power, and incentive with researches of this area. This is the line of research that is extremely important for the institute, and we gotta have some other access so as to incentivate and develop. The institute is a small one considering other institutions, though, but the importance of producing medication and to contribute for the debate for the policy, the health policy, it is extremely important. And I would like to wish you that the webinar can go on with contributions, especially in this field that Christianity remind us with people taking part of the Brics with a great number of different economical interests and sanitary ones. Also, considering the poll, the group, I would like to thank everyone for the effort to bring the guests from other institutions in other countries, and we're going to have the opportunity to listen. I think that this is very important, and I would like to wish you that the seminar would produce that this line of work can be a line of work, the research that we can support and that we can have some good contributions. So I wish you all a good seminar, and thank you for all those that came from abroad. With the floor, the chief of good morning, everyone. I would like to thank Una Cristiani from the school. I would like to reinforce the possibility to represent the story, to salute those who are giving support, the people from Gunnar that were in the effort to produce this. And as a manager of this department, I would like to thank and see the possibilities and the effort to so that we could develop relationships and partnerships and the research for this key role in that relationship, considering the approach that was given for the tertiary sectors and health sector, the research and political formulations. So this is just one reason I would have the possibility to stay here for the whole seminary, through the whole seminary, and I think that I'm going to learn a lot with the experience that will be presented here, and to build actually some partnerships and subside to articulate, to enhance the department so we can have these actions possible. I wish you all a good seminar, and that from this we can move on to the new actions that actually will dip in these 2 days. Thank you. We're going to listen now the research coordinator, social and market, Paulo Henrique Rodrigues. Good morning. It is such a great pleasure to start this seminar. It's such a great work to organize a seminar. We are a research group, a small research group, but we have worked hard from understanding part that we have that is impossible to have a system, public health systems and universal ones such as SUS. With the medication policy that is proper one, we have such a bad problem because we are one of the biggest market for human use in the world, and with the second or third for animal, and the Brazilian production of medications and research, and the fermentation for human relations for this company that is extremely important. It is way beyond the system and specifically the Brazilian population. We are one of the greatest economies in the world and we have such a great gap in this area. It is an area, like Christiani said, that historically it has the control of very few companies. Is It's multi companies, specifically from the United States and Europe, and recently fruit of change that we have, geopolitical that we are having in the world. That the impression that I have is that it's going to change 600 years of the. It started in 1914 when the Portuguese actually controlled Ceuta and Morocco, and we had the Portuguese expansion. So we have such a great change. Some countries with such a great effort, which is China, for instance, India, and Cuba, with all the difficulties that this blockage in Cuba have, and they have been able to break that monopoly, that breakage, that a certain interest for many people, and a lot of difficult problems to the access of the humanity for medications. I have to remember you that we have 1 week, according to the international analysts in Kazan, Russia. It is going to be a new Bretton Woods, and Kazan Woods Brics will be together and it will be defining a new financial monetary policy. It's such a historical moment, and we have our seminar 1 week before. Of course, our seminar is way more modest than we're going to have within a week. I would like to thank Theo Cruz because they were extremely important having this event. We have a partnership. People are here, and I'm not gonna name people because we're gonna have enough time for that. And it's such a great effort from our research group because many people working in a group, although it's a small one, it's a small group. But I would like to mention specifically 3 groups. Christine, who is the president of Fiocruz, and she's been having a postdoc with us. Leninha, who had the doctorate, she's there, and vice director Osvaldo Cruz, and Tayani, who is a director here, and they and I would like to say that we have a partner, a friend, Lana Correa, who has such a great work. She's with her mother at the special cares at the hospital, and she's here at least for the opening. She's such a great partner, and so anyway, to start, please.
And to continue, we will invite the authorities to take their seats in the audience. The first panel of this seminar will bring the topic of the challenges for innovation in the Global South and possibilities of South-South partnerships. In order to start our discussion, we will invite Dr. Aparna Srivastava, who will participate online, and she has been responsible for the Department of Internal Trade and Industry of India, the Director of Department of Innovation, Access and Medicine and Health, PAHO, WHO, Judith Rios San Juan, and also the Latin American Drugs for Neglected Disease Initiative, Sergio Souza Estani. And as a mediator, we will invite the advisor of the Vice Presidency of Production and Innovation in Health from Fiocruz, and also researcher at the National Public Health School, Jorge Bermudez. Let's wait just a couple of minutes because we have a connection problem with people who are coming to us online. We're trying to connect to our lecturers who are in India. We will start in 5 minutes. Well, I apologize for this delay, but we are still on time for the seminar. For me, it's a great honor to take part here as a mediator of this first panel, and I think after we heard of our authorities in the opening ceremony, I think it's very clear that we have challenges ahead of us, and we have a lot to do, and we have a lot being done, and we still have to strengthen partnerships in order to continue on track. So I think it is very important to mention that. So what do we want from this first discussion? This first discussion will be, well, we at least expect to discuss a little bit of the challenges of the innovation for Global South, and how did India become a great exporter of pharmaceutical products, and the possibilities for partnerships, South-South partnerships, which are ever growing. And we have seen recently in G20 the Ministry of the Brazilian Ministry for a Global Alliance in Education and Innovation. So I think this will be implemented. That was a unanimous vote. So this will increase the amount of contribution we have between our countries, and we are working in that. Because it is an innovative proposal, it's a challenging one, but it's still very factual. So we have three great participants here. We're having connectivity problems with India, also because of the time zone, of course. I would be the first to say we have time difference there, so it would be I will be the first problem. We also have Judith Rio San Juan from PAHO in Washington. She's connected, so that we are going to hear from her first, and then we will talk to Sergio. So we also have India with its expertise in production. We also hope to hear a little bit about the Pan American Health Organization as a leader of these efforts towards better South-South cooperation in the Americas. And we will also hear from Sergio Sousa Estiani. Has been working with production for 20 years now, and he just added to his annual report the development of 45 projects, including 20 clinical assays. So those are 20 years of research and development. And also the production since 2003, so when he started by the Nobel Prize of Medicines Without Borders, 3 treatments for 6 diseases, and more recently advancing further, and now it's more than a partnership, this is a model for development. So in order to speak about our guests here, we have Aparna Srivastava. She was a member of the Indian Administrative Service for more than 20 years, with a broad experience in the national and subnational and local governments. Her main experience areas are public finances, policies and planning, and governance, urban health, and she has been the secretary of the Indian government for 3 years, from October 2020 to October 2023. She's contributed to the Indian response to the COVID-19 pandemic, and also for the development of the medical research sector and promoting research and policies to innovate in medical devices. On the long run, she's also concentrating on support to the health service users and the innovation and competitivity of the Indian pharmaceutical industry. And after her, if she is able to connect, we will hear from Dr. Judith Rio San Juan. She is the director of the Department of Innovation, Access to Medicines and Health Technologies at PAHO, WHO in Washington, since November last year, so almost a year as a director there. And she's a lawyer. She's a specialist in global policies with more than 20 years experience. She has worked in the civil society, academia, and international associations, and more recently in the national program at the UNDP. So she has been licensed by the Fabra University and Geneva University, and also from Stanford Law School. And she has lectured in many institutions as well. So after them, we will have Sergio Sosestani. He's a doctor, graduated out of the Coburg National University in Argentina. He's has a master in epidemiology and endemic diseases from Fiocruz, and also a doctorate in Buenos Aires, Argentina, and also Tulane University in New Orleans, United States. He researches on about the tropical diseases for more than 20 years now, and he's responsible for more than 20 projects on Chagas disease and also endemic and emerging diseases. He has been a consultant of the PAHO and also has been a researcher on the National Science and Technology Department, also director of the Institute for Parasitology of the Ministry of Health in Argentina. Until he joined the DNDi team in 2016, when he became a leader of the Chagas disease program, and now he's the director of Latin America for DNDi. So, in addition to all that, he's also a great friend of ours. So we have known each other for a long while, and we are always together. So initially, we just got the great news that Dr. Aparna is now connected. So let's hear from her. Aparna will speak about the challenges they face in India that she has faced and what she has to propose as a directive for us. So, Dr. Srivastava, you have the floor.
Não temos som?
Do we have sound?
Welcome, Dr. Aparna. You are mute. We cannot hear you.
I have now unmuted myself. Good morning.
Aumenta o volume. Please go ahead.
So I have a short presentation. Should I share it from my side? I just sent it to your office, but I can share from here too.
Please share it.
I just do that now.
Please share the share screen. Okay. That's okay.
So it is now available. You can see it.
Yes, we are seeing and hearing you.
So we are operating intercontinental. So Dr. Rodriguez, should I start now?
please share? You are sharing your text. Please share the presentation.
Can you see the presentation?
No, we are seeing your text. Oh, now we
Okay.
are. Yeah, okay.
This is Aparna, please. You have a green button at the bottom of your screen. You can, yes. And now, if there's a little.
Is it shared now?
Yes, it's shared. There's a little book in at the bottom of your screen again. If you click on it,
You're able to see the presentation?
Yes, we can. You can go ahead, please.
Please go ahead.
May I continue?
Yes.
Dr. Rodriguez, may I continue?
Yes.
Yes, you can. You can continue.
In the bottom, the right side of the screen, so you can have the full screen.
You want to see it in full screen mode?
Yeah. Well,
Okay.
you stop sharing it. Vocês têm a apresentação aí?
Do you have the presentation over there? Can you share that? If you have the presentation, please let us share from our side. No, let her know.
No.
Or I've already sent it to your office. If you wish, you can display it from your end.
Are you hearing as well? Because
I cannot hear you very well.
Okay, we will share your presentation that we have here with us.
Okay, that I think would be better.
Tell us to move on.
I will do that.
Ok? Então vamos lá.
Can you hear me? This is interpreter speaking. Dr. Srivastava, can you hear?
I'm waiting for the presentation. Will I be able to see it?
Estão conseguindo abrir aí? We are trying to open your presentation that we have here. So it
Okay.
will be easier for you to be talking while we are passing your presentation. Como vocês veem, nem tudo é perfeito, né?
As you can see, not everything is perfect, so we're getting there.
Right? Can you see the presentation now?
No, we are not.
Can you see it now?
Are you sharing it with us? We cannot see.
Yes. Okay.
Vem cá,
Share
mas então
screen.
deixem ela apresentar. Deixa ela. Please share it. Share
Yeah,
the
we'll do it.
presentation.
I'll do this.
See, Maya. We're trying to set your presentation from here.
So we started.
Okay,
I started
okay.
sharing.
We are here. Okay.
Okay. Can you see it now?
Yes, we have your presentation.
So I'm sharing it, I believe.
No, we are sharing. Tá aqui, né? We are sharing
No,
it from
I'm sharing
here.
now. I'm sharing and I'm starting now, Dr. Rodrigue.
No, we are sharing your presentation. Can you see the slides?
I cannot see the slide on the screen, Zoom screen.
Ela não está vendo.
I have one. I am screen sharing, so you should be able to see.
Não, mas ela não pode. Se ela
I'm sharing a screen. Does the slide move?
Are you seeing the presentation that we are sharing from here?
No, I am not.
Okay, then we turned it off.
Uh-huh.
we turned it off, and you will share the presentation with us.
And
Okay.
you see whether you can see it, right?
No,
Okay.
we cannot see it yet.
Yeah. I will share and you please tell me whether you can see it.
Mas ela, o problema é que ela, a gente compartilha, mas ela não está vendo os slides, então não sabe o que falar. Não.
Can you see it now?
Yes, yes.
Okay, good. So I can't see any of you.
Okay.
I can only see the presentation on my screen and you can see it. So we may start now, I think. May I begin?
Okay, you can share it and go on, and we are hearing you and seeing the presentation.
Okay, wonderful. Thank you.
Okay.
Um,
Thank you very
these
much.
things
and
happen, right?
Thanks
Sure.
for your patience.
So, good morning to all of you. I'm very happy to have this opportunity to share some insights, of course, briefly, about the growth of the Indian pharmaceutical industry and the way forward that is being adopted in the sector. I am sorry that I could not be present in person for a richer interaction with the experts present in this conference due to my personal circumstances, but I do hope that the brief presentation that I plan to make in this session will be useful and contribute to the overall understanding of the global requirements uh, of the pharmaceutical sector. In the last COVID-19 pandemic, the importance of collaborative efforts and global cooperation was highlighted to ensure that collectively we are able to provide the necessary medicinal products for patients across the world, medicines that are of good quality and are available at affordable prices. In this context, I would like to mention that India has emerged as the largest supplier of generic medicines with about 20% share in the global market. Indian pharma products are exported to almost all continents, with 55% of the exports going to highly regulated markets, thereby indicating that quality capabilities of Indian manufacturers meet these stringent requirements. India is also one of the biggest manufacturers and suppliers of low-cost vaccines across the world. And therefore, during the 3 years of the COVID pandemic, Indian pharmaceutical industry could play its role, and it also showed both its resilience and its commitment by providing medicines and medical products to about 190 countries, and thus came to be known as the pharmacy of the world. One of the reasons that India has a strong dominance in generic medicine capabilities is that the Indian domestic market is highly price sensitive, and therefore there is relatively less incentive for investors to enter into high value advanced therapeutic products. So India has developed proficiency and dominance in generic medicines. This slide attempts to give a snapshot of the contribution of the Indian pharmaceutical industry to patients worldwide on a global scale. 60% of the global vaccine production originates in India, with Indian vaccine supply providing 40 to 70% of WHO's demand for universal child immunization. As I mentioned, with 20% share of the total global exports of generic drugs, India is the third largest pharma supplier in terms of volume. In terms of value, India is ranked 11th, and this again indicates that the affordability of the Indian generic products have been able to drive access to affordable medicines, not just in the developing world, but also in advanced markets like the UK and the USA. At the same time, the quality of Indian generic medicines is evidenced by the presence of the largest number of US FDA approved plants outside of the United States, and also the large share of approvals, ANDA approvals for Indian manufacturers. All this did not happen overnight. The Indian pharmaceutical industry is close to a century old. The early domination of the industry was through the public sector manufacturers. That was pharmaceutical manufacturing companies set up by the governments, and the focus was on essential medicines. At that time, Indian manufacturers also developed very strong capacity in production
Please,
of antibiotics
just a
and
minute,
fermentation based APIs.
just a minute. You're not advancing the slides.
Oh, really? Are you at slide number 4?
We
Historical
are only
overview.
seeing the first slide.
Slide number 4.
Are you passing them?
Yes, historical overview is the topic.
Aqui não está chegando.
We are not seeing the slide number 4. We can see only the main one, the first one.
Okay, we are seeing technically what is the best way to do it. E então? Não?
Can you see now?
No, we're not seeing the slides.
Ah. And now? Now is it visible? I'm surprised.
We will try to pass your presentation from here.
Okay, I'm stopping sharing.
Let us know if you are seeing there.
Yeah, that is the problem. I'm not able to see when you share it from your end.
Okay. Are you seeing the slide?
No.
Ela não está vendo. Okay, we're on slide number 4. So
Okay.
please tell us when to go to slide number 5, 6, 7, etc. And we will move them here, okay?
Okay, all right.
Okay, thanks.
So we are on slide number 4, which is the topic historical overview. Am I correct? Slide number 4, historical overview.
O que tiraram aí?
Yes, I can see it now, finally.
Okay.
Good, great. So I will continue. As I was mentioning, the Indian pharmaceutical manufacturing began in the 20th century, of course, with the domination of the public sector manufacturers. These were manufacturing plants which were set up with the public investment by the government. And the domination of this public sector manufacturer also meant that the focus of the production was on essential medicines used for public health requirement, essentially. These manufacturers also had a strong capacity in antibiotic productions like penicillin at that time and fermentation-based APIs. However, in the 1980s or so, we saw the rise of private enterprise in pharmaceutical manufacturing and a concurrent decline in the public sector units. At the same time, there was significant price pressures because of government policy, which was geared towards affordability and low cost availability of medicines. And there was also global competition rising in terms of low cost drugs. This led to an increased reliance on import of active pharmaceutical ingredients for the Indian pharmaceutical industry, and that continued till the COVID pandemic. And this has, as I mentioned, contributed to the preponderance of generics in the pharma portfolio. During this period, there was also the growth of the vaccine industry. It grew in a very robust manner. We have large manufacturers who can supply quality vaccines at very affordable prices. You would recall that India came up with also medicines at very low cost for the HIV epidemic. As well as in the vaccine sector, we have niche players who produce and develop their own product. Next slide. Next slide, please. Next slide, please.
Now is in the slide number 5.
Agora nós estamos vendo o slide número 5.
So, as a result of this growth phase in the 20th century, today India is home to more than 300 pharmaceutical companies with a strong network of about 10,500 manufacturing facilities on ground, which offer about 60,000 generic brands across 60 therapeutic categories. The industry's vision is now to grow to a size of 120 to 130 billion US dollars by the year 2030 from its current size of about 50 billion US dollars. Next slide, please.
Now number 6.
Thank you. Looking to the changing global health scenario and the emerging challenges in recent times, the Indian pharmacy sector has also responded with the evolution of its goals and priority areas. Being an industry that also has a human aspect, we have identified two sets of goals for the Indian pharmaceutical sector. These can be classified as strategic goals and societal goals. The strategic goals include the attainment of drug security and ensuring global competitiveness of the domestic industry. This is sought to be achieved by building self reliance in essential drugs, by participating in resilient global supply chains, and by regaining our diminished capacities in terms of production of essential active pharmaceutical ingredients. The effort to increase domestic manufacturing capacity and a shift towards new age therapeutic products is also sought to be achieved by focusing not only on scale but also promoting research and innovation in the sector. The societal goals for this sector in India center around affordability and quality as twin objectives that should feed off one another. Affordability is sought to be achieved through a robust pricing mechanism and a focus on availability of generics of good quality, whereas drug quality is sought to be further strengthened by aligning it with public health needs and ensuring the safety and quality of manufacturing as well as distribution practices in the domestic market. May I request you to shift the slide? Next slide. Slide number 7. Strategic areas.
Yes, number 7.
Okay, thank you. These goals are further translated into strategic areas for intervention. So, in terms of both policies and programs, namely technology, research and development, funding, and human capital. And all of these areas would be geared to ensuring the essential goals, which are sustainable growth of the sector, adequate access and affordability for the patient community globally. Next slide, please.
Number 8.
Thank you. So through a consultative exercise with industry and other stakeholders, the government did arrive at identification of various areas for intervention, including, as I mentioned, in technology, investment in advanced manufacturing technologies, synergy with the very strong IT sector that we have in India, in product development, manufacturing, as well as therapeutic management, the use of technology for development of new diagnostic techniques, as we saw during the COVID pandemic, and the focus on use of health data in a responsible and systematic manner to develop personalized medicine and healthcare for better patient management. The pharmaceutical sector is also now given an impetus for innovation so as to change the essential characteristic of the sector from a low cost, volume based industry towards a value based portfolio in which there will be an attempt to promote disease focused research using innovative technologies, particularly to address, and I hope that you would also appreciate this, to address the neglected diseases, the tropical diseases, which have high morbidity and mortality in the developing world, in the South. It is also aimed to give more importance to develop India as a region for clinical trials, given the large availability of patient population as well as the uh, good diversity in terms of the disease profile that is available for clinical trials here in India. And this impetus for research and development also envisages collaboration with international universities as well as research and industry units in advanced countries vis-a-vis the domestic industry and domestic research institutions. Next slide, please.
Okay.
Overhauling it to support innovative product development at the same time. The sector is also looking at upskilling and reskilling of the manpower to align it with future requirements of the industry and new emerging technologies that are coming into the sector, and also create a robust platform for systematic and sustained industry academia collaboration. India already has, as you would well know, a very vibrant startup ecosystem, and we would like to leverage this ecosystem and enhance it for the pharmaceutical sector and the healthcare sector also. Maybe move to the next slide.
Okay. Slide 10.
Thank you. So in the government of India, that is the central government, federal government, there are two departments, the Department of Health and Family Welfare, as well as the Department of Pharmaceuticals, that share the responsibilities for facilitating sustained growth of the pharmaceutical sector, and a number of policy, legislative, and programmatic interventions have been made for such growth. So, apart from the national pharma policy and the pharmaceutical pricing policy, we also now have a new policy to promote research and development and innovation in the pharmaceuticals and, in fact, the medical devices sector also. The Drugs and Cosmetics Act, which is administered, as you would know, by the regulator, the Drug Controller General of India, has also been tweaked and is being modified to roll out various regulatory frameworks that ensure that the industry can assure quality as well as safety of the drugs available for the domestic and export market, and at the same time pursue innovation in its product range. Infrastructural interventions are also being made. That is to expand the capacities for the manufacture of bulk drugs through the setting up of bulk drug parks, and also to create human capital through the NIPERS, the National Institutes for Pharmaceutical and Education and Research, to create the human capital which is required for the growth of this sector as a value-based industry. Next slide, please.
Okay, slide 11.
Yeah, because the slides are not moving on my end, on my screen. That is why I have to request you. So I will continue. Now, while quality and innovation are, of course, very important aspects for the development of the pharmaceutical sector, in India, and I'm sure that would be the case also in Brazil, affordability of the medicines continues to be an essential goal because it is essential to ensure that quality medicines are available to every patient at affordable prices. So there are a number of government supported initiatives such as Ayushman Bharat and Pradhan Mantri Jan Arogya Yojana, which ensure the availability of affordable healthcare for the domestic population. You would be happy to know that the Ayushman Bharat program has an objective to cover up to 500 million persons under the risk apportionment insurance scheme, which is probably one of the largest globally. Another important tool, and I would take a couple of slides on this, for ensuring availability of affordable healthcare, especially pharmaceutical products, is the price regulation of pharmaceutical products, particularly those drugs which have been declared as essential commodities under the National List for Essential Medicines. Next slide, please.
Okay, changed.
Okay. So this one is the slide on pharmaceutical pricing policy.
The
Is this
slide
the
is
slide on
objectives.
pharmaceutical pricing policy?
The slide is objectives of MPPP 2012.
Yes, that is correct. Thank you.
Okay.
Thank you. Yes. So this slide actually gives just some overview on the national pharmaceutical pricing policy. And what it says is that the policy of the government is to ensure availability of through putting a place a regulatory framework for pricing of drugs in a manner so as to ensure the availability at reasonable price while supporting the growth of industry and providing opportunity for innovation and competition. So next slide, please.
Okay.
There is an organization here
Ensuring
in India called
affordability.
the National Pharmaceutical Pricing Authority, NPPA, and this was constituted in 1997 as the principal agency of pharma price regulation. Through this agency, various mechanisms have been adopted for fixing the ceiling price of essential medicines, for regulating the growth in prices of the non-essential or non-scheduled formulation, and it is estimated that there has been an annual savings of around $1 billion to domestic patient community through this variety of interventions that I have just mentioned here. In addition to fixation of ceiling prices and retail prices for some of the drugs, efforts have also been made to regulate the trade margin in some of the products, including drugs as well as some medical devices, which have also resulted in moderating prices, especially during the COVID pandemic. Next slide, please.
Okay.
An innovative mechanism, which I hope will be of interest to you, for making affordable medicines of good quality available to citizens is an intervention or a program called Pradhan Mantri Bharatiya Jan Aushadhi Pariyojana, which translates roughly into Prime Minister's India's public drug availability program. Now, this is a very noble initiative because it provides for the sale of generic medicines through exclusive outlets through a franchisee model. So, the investment from the public sector, that from the government, is quite low, which is leveraged through a network of entrepreneurs. There are almost 9,500 such outlets in the country today. Next slide, please. This program is supported by the national government, by the federal government, and you would see that the number of outlets has grown from a mere 80 outlets across the country in 2014 to almost 9,000 and odd outlets now in the country. I believe the current number would be 9,500. Similarly, the product basket of generic medicines and surgical supplies available in these outlets has grown from 400 products that were available about a decade ago to 2,000 plus products being available now. And the sales have also, as you have seen, grown tremendously from less than a million to over 120 million worth of sales through these outlets. What is noteworthy that all the products sold through these outlets are priced at a selling price which is 50 to 90% lower than the market price, although they are sourced from reputed manufacturers having the GMP certification. The franchisee model ensures that we are able to provide these medical products, as I said, generic drugs, as well as some surgical supplies, at a price that is 50 to 90% lower than the market price. And therefore, as you can understand, these outlets are extremely popular. They have been instrumental in providing affordable drugs of good quality in the country. And it is estimated that on an average, 1 million persons visit these outlets every day to avail of the benefit of this program. Next slide. Next slide, please.
Thank you. Okay.
So, brief overview of this Indian pharmaceutical sector that I have provided is intended to highlight that the sector is committed to quality, access, and affordability, not only for the Indian patient population, which is of course quite large in its own level, but for the global patient community, since we do believe that healthcare and affordable healthcare is a global public good and should be made available worldwide as a human goal for universal well-being. Thank you. That will be all from my side, Dr. Rodri.
Dr. Aparna, thank you very, very much. And on behalf of the organizers, sorry for the confusion in the technological sharing of the slides. But at the end, we heard you very well. We saw the slides. And I will have some very brief issues to discuss with you, because we know that it's night in India, and we don't expect you to stay all the time with us, but if you are welcome to stay all the time if you are able to. But I think you gave us a very comprehensive review, and you had several keywords. Você teve algumas palavras-chave. The complexity of local manufacturing, a complexidade de produção local, que a Índia é o maior jogador, o largest player na arena de acesso a medicamentos. Affordability é uma questão que é muito importante para nós. Affordability is very much important for us, because we cannot have innovation without affordability. And we will never have access with.
Nós não podemos continuar sem ter essa affordability. E outra parte importante é o crescimento. Esse portfólio, esse crescimento em outros países também.
I don't think we will have time for questions, because it will take so much time. But we thank you very, very much for your presentation. That was very much comprehensive and very much useful for the objectives of this seminar. Thank you.
Thank you so much, Professor Rodrigue. Please feel free to reach out to me if you would like any other inputs. What I will do is convert the uh, presentation into a PDF file and send it across to your office so that you can include it in the conference records. Would that be okay?
Thank you very much. Yeah, thank
Thank you
you
so much.
very, very
I'm
much.
afraid I
Thank you
must
so
leave
much.
now. As I mentioned, I have certain responsibilities, so I'm unable to stay for the entire day. But thank you for having me in the beginning. Thank you so much.
Agradecemos à doutora Parna e em seguida então passamos para outra transmissão online.
We would like to thank Dr. Parna, and now we're going to go to the next presentation online. I hope that is less disruptive, and we also have here the slides here of someone who is the director of Department of Innovation and Access to Medicine and Health Technologies of OQUAS and PAHO and WHO. Judith, can you hear me?
¿Puedo hablar en español o inglés? No en portugués aún.
If you can speak only in English.
Buenos días a todos. In English. While we wait for the presentation to upload, I understand you're going to be uploading it from your side, correct?
¿Quieres que lo compartamos aquí o tú lo compartes?
Como ustedes prefieran. Yo tengo la presentación abierta, como ustedes prefieran.
Lo tenemos aquí. ¿Está? Ok.
Correcto.
Ok, para compartirla de aquí.
Estoy viendo las slides.
Ok, entonces comienza. You can begin.
Comienzo. Muchísimas gracias. Thank you very much again. My name is Judith Rius, and I am the director of a new department that PAHO created last year on innovation and access to medicines and health technologies. I want to especially thank Fiocruz as well as the Universidad de Estado de Rio de Janeiro for the invitation. But if you allow me, I would like to extend a personal invitation to Dr. Jorge Bermudez, who is a mentor of mine for many years and a mentor of many that work on innovation and access to medicines around the world. So I would like to recognize your expertise and your guidance over many years for people like me that have been working on access to medicines for over 20 years. I hope that doesn't disguise how your age, Jorge, but just your knowledge and your experience on this matter. Next slide, please. As I mentioned, I am the new director now for a little bit over 10 months of a new department that PAHO created in 2023 that coordinates the technical cooperation of the organization on innovation and access to medicines and other health technologies. We work across all categories of health technologies, including medicines, vaccines, diagnostics, medical devices, radiological, blood products, and organs for transplantation, because we believe many of the access needs that we see in the region go beyond medicines. And as COVID-19 demonstrated, there is a need for fundamental changes on how the region, member states,
No te estamos oyendo. No te estamos oyendo, Judith. Judith, ¿estás fuera?
Hello, I think I
Okay,
was
okay.
disconnected for a moment.
Regresaste, que saliste y regresaste.
I'm so sorry. I don't know what happened. I apologize for that. Can we go to slide 2? Hello? I'm seeing a presentation, but it's not my presentation. Yes, that's one. Thank you so much. Can you see the slide 2? I can see it from my side.
Which one?
This one. Can you see that slide that I'm seeing on the screen?
Yeah.
Yes?
Okay, yes.
Perfect. Thank you. Apologies for that. I just want to highlight 3 core areas of technical cooperation that we focus at PAHO, and that we believe are 3 core areas or as the part of the ecosystem of strategies that the region, as well as BRIC countries, of course, as I understand this conference is an international conference that speaks also to the needs and challenges of other countries beyond countries in our region. The 3 core areas of technical cooperation are access to medicines and health technologies, and that's led by the Access Unit. This focus to a broad variety of access policies and strategies that member states and partners need to ensure evidence-based decision-making and rational use of health technologies. Includes, for example, the use of health technology assessments to ensure evidence-driven selection of technologies, includes the promotion of competition to increase affordability and availability of health technologies, as well as increase of transparency to ensure that member states and decision makers have access to key information currently many times not available across the life cycle of technologies, including prices, intellectual property, and other key inputs in the strategy to ensure that technologies are available. The second unit is the unit of quality and regulation. This is a core priority also for PAHO. is to ensure that medicines and other health technologies are not only available and affordable, but that they are safe, effective, and of quality. So key intervention is to strengthen regulatory systems of in member states, as well as strategies and that private and public sector pursue to ensure that tech technologies are of quality when they reach populations in need. These two first areas, access to medicines and quality and regulation, are traditional areas of technical cooperation by PAHO. We have more than 20 years of experience supporting member states on these efforts, but of course we continue to innovate and grow in our work, and we continue to listen on how our work could improve and what are the needs of member states and partners on the region to ensure that both the access and the quality and regulatory issues are coherent, comprehensive, and impactful. Today, I've been asked to specifically speak about innovation, and I want to highlight a recent special program that PAHO created also last year. That is the special program on innovation and regional production. This is a platform that member states created last year as a response to a resolution that passed in 2021 in PAHO governing bodies. It's a resolution that mandates PAHO to strengthen and expand its technical cooperation to include strategies that promote regional innovation and production for essential health technologies. We have a couple of years of experience, so a recent area of work at PAHO on this work, but we have already important lessons and important challenges that I would like to share with you today. Next slide. Thank you. So first, a little bit of a regional context. You all know why working on innovation and regional production is so important for our region in the Americas and the Caribbean. But just so we are all aware, again, COVID-19 and the inequities in access that we all witnessed during COVID-19 demonstrated three main factors that contributed to that inequity, among others. First, the commercial and technological dependence that exists in health technologies in the region. Just to give you some numbers, imports in pharmaceutical sector, only 30% are intra-regional, so very little regional export and import of health technologies across countries of our region, and the volume is 6 times higher than exports, according to data prior to COVID from 2020. Existing manufacturing capacities are important, including, of course, in Brazil, where I'm currently speaking, but most of these concentrated to national markets and national priorities. There is limited access to the existing manufacturing capacities of countries in the region to regional markets. For example, unlimited supply to pool procurement mechanisms like the PAHO regional revolving funds that pool the markets for vaccines and other health technologies to increase access at a regional level. A recent meeting that we hosted here in PAHO last week that looked at the mapping of existing manufacturing capacities for vaccines show that although there is important manufacturing capacity in the region, especially for vaccines, but also for other health technologies, there is limited capacity for drug and API manufacturing. So that dependence, even if manufacturing capacities exist, is highly hurt or highly limited by the lack of supply independence, including drug and API manufacture in the region. So for us, this is a core priority that the region, as well as Brics countries, should prioritize, is increasing independence, not only on fill and finish and early stage manufacturing capacities, but also increasing independence in drug and API manufacturing. As I mentioned, there is a high concentration of production globally. 4 companies control 74% of the global vaccines market, according to WHO 22 data. And this has been even further emphasized during COVID-19, as we all know, most of the market for COVID vaccines was centralized in a few companies, a few stakeholders. And finally, there is limited expenditure on research and development. And in fact, most of the expenditure is concentrated in G20 countries, including, of course, Brics countries. There is also limited access to new technological developments and knowledge, especially in Brics countries and developing countries, where we see a lot of these technological developments protected by intellectual property and other commercial strategies that limit access to the latest technological developments and knowledge to really bring the innovation capacity of the region and other BRIC countries to in sync with the latest technological and knowledge developments. Next slide, please. So what are we trying to do at PAHO specifically? And I hope this helps shape the conversation about some of the priorities that we are identifying, but also some of the challenges that we are identifying. So our work plan as part of the Innovation on Regional Production platform that I mentioned that was launched in 2023 focuses on 4 core programmatic areas of technical cooperation. First, we believe that it's key to strengthen regional ecosystems. We believe it is key to consolidate regional demand and sustainable financings, so the efforts to promote regional innovation and production are not only sustainable, but also are access and public health driven. Here, the work of institutions like and mechanisms like pool procurement are essential. Last week, in the Directing Council of the Pan American Health Organization, member states agreed to significant changes to the regional revolving funds to try to increase the share of regional producers from Latin America and the Caribbean in the technologies that the regional revolving fund currently procure. As you might know, the regional revolving fund has been a mechanism that has focused on access, on pricing and quality of technologies that procures for member states. But until now, most of the technologies that the PAHO regional revolving funds procure are from outside the region. We believe that with the changes that member states made last week in the Directing Council to the regional revolving funds, as well as additional changes that we are working within PAHO, we are able to change and really adapt this key demand consolidating and sustainable financing mechanism for the region of the Americas, so it's more responsive to regional innovation and production needs and opportunities. Second, we provide technical cooperation to member states to develop and implement multi-sectorial access-enabled policies and to promote the development of ecosystem. The challenges of regional innovation and global innovation go beyond the needs and the mandates of ministers of health. We believe it is essential that we engage with multi-sectorial policies that include ministers of trade, ministers of science and technology, intellectual property office, ministers of finance, really a whole ecosystem of government strategies and a whole ecosystem of whole government approach to ensure that there is coherence and complementarity in these policies. There is also a need to strengthen human resources capacities to develop and produce health technologies. We are exploring and trying to promote the creation of regional centers of excellence for building human resources capacities in our region to develop and produce health technologies, including the most innovative and advanced health platforms, but not only. And finally, part of an ecosystem to enable innovation is also to ensure regulatory capacities are strengthened and are more efficient, so we harmonize and reduce timelines in regulatory strategies. So this is a core pillar of our technical cooperation. That's the first box that you see on the screen. The second box and the second pillar is to support specific research and development, innovation and production initiative. At PAHO, we have started really building on the lessons of COVID-19 on building mRNA vaccine development and manufacturing capacities in the region. On that, we're working very closely with Fiocruz in Brazil, as well as with a public-private consortium in Argentina, Synergium, and the government of Argentina as our 2 initial partners on this project as part of the WHO Medicines Patent Pool Global mRNA Tech Transfer Program. But we want to expand beyond these two partners, Brazil and Argentina, and beyond COVID-19. And 2 weeks ago, we hosted a meeting also in Brazil with Fiocruz, where we invited partners from around the region and from many countries around the region to explore the use of mRNA technologies for other health priorities for the region and how to promote collaboration and South-South partnership on the development of these technological projects. We think that model, South-South cooperation regionally, could and should be expanded to include also other Brics countries and interests in partnering across regions to develop and co-develop innovative strategies for new platform technologies for vaccines as well as for other technologies. The third box or the third area of technical cooperation is generation of information for decision making. Many times we see governments, public and private sector, and other partners in the region don't having access to strategic information for decision making, for investment on innovation. For that, we are commissioning and have commissioned a variety of studies that look at key decision and information, key decision-making information and access to increase transparency and access to information that we think is essential for public health and sustainable decision-making and investment. We have commissioned studies on best practices, on technology transfer agreements, but also challenges. We have developed studies on policies that member states can promote to promote innovation and regional production. And we have also commissioned and are preparing to publish a study on intellectual property landscapes and intellectual property strategies around mRNA technologies, for example. So these are just examples of some of the data that we're trying to put in the public domain. So regional stakeholders, member states, academia, and partners can take better informed decisions on promoting innovation and regional production. Finally, we believe the region is stronger if we promote regional dialogue, coordination, and cooperation. And for that, events like today that promote multi-regions and Brics cooperation and dialogue really brings this agenda to the next level. We have signed MOUs with a variety of partners. For example, a few weeks ago with Africa CDC, we received a high-level visit of Africa CDC into Baja headquarters. We are signing an MOU and developing a work plan that aims at promoting South-South cooperation in the promotion of strategies to increase access, innovation, and regional production of health technologies. We also are trying to establish regional strategies so both innovators and partners, but also member states, create a stronger coordination and cooperation mechanisms that we think are so important for the sustainability of these efforts. Next slide. If I might define our philosophy in one slide, I will try to do it with this slide. We are working on a variety of strategies from access policy. Next slide, previous slide, please. Apologies. This one, perfect. Increasing equitable access is the core of what we're trying to do. We are supporting member states, and we hope this meeting address a variety of strategies through the life cycle of technologies: innovation, tech transfer, production, regulatory strengthening, selection and rational use of health technologies, strengthening supply and procurement, and of course, coherent national, global, and regional access policies and strategies. But at the center of the slide, you could see equitable access, because we believe this should be the fundamental guiding principle of our efforts. That's easy said than done, because many times when we are evaluating or exploring technical cooperation, we understand that some of these strategies are sometimes not coherent, sometimes not aligned, and sometimes not really focusing on these core objective or principle to ensure equitable access. But that's our goal, that's our guiding principle, that's our guiding north. And that's one of the suggestions that we would like to put on the table in this seminar today, is that we increase visibility, coherence, and understanding on how the different interventions to promote innovation as well as access to health technologies are better connected. Next slide. We have been asked at PAHO and specifically to provide concrete opportunities, suggestions for concrete opportunities to promote innovation and partnerships among Brics countries. We have done a little bit of an internal exercise to highlight some low-hanging fruits that we think are essential for Brics, and some of them are already in the areas of cooperation that Brics are exploring individually or as a group. So some of them are already part of the agenda. Some of them we think could be reinforced. Of course, Brics countries have a broad variety of needs, and they're very different. Even if they share common interests and common challenges, they are different in their political projections, they are different in their socioeconomic indicators, and they are different on the public spending structure. But we believe there are, despite the diversity and those differences, there are common challenges and common needs that could be better addressed if there were collaboration among Brics partners and member states. I have highlighted some of the areas of innovation where we see important research and development and innovation needs that could be better addressed, like tuberculosis, neglected tropical diseases, and antimicrobial resistance, for example, that could better be addressed with South-South cooperation and innovation partnerships. We have also added the non-communicable diseases and the anti-diabetics as key areas of further exploration, although much focus will be and should be on neglected diseases and neglected patients, including as part of the important proposal that the government of Brazil has put forward in the G20 that PAHO strongly supports, including the creation of a global alliance to promote access, innovation, and production of health technologies. We believe additional efforts could be made to include access needs and innovation needs of non-communicable diseases, including cancer and diabetic, cardiovascular conditions. Many of the challenges that we face in non-communicable diseases are not only of innovation, but of access. We see an epidemic of high prices and high costs that affects all Brics in terms of limited access to many of these health technologies. We see an opportunity as many of these technologies, including, for example, several anti-diabetics technologies, that are patent protected, are seeing the terms of patents expire in the near future or in the near future. We see this as an opportunity for South-South cooperation, as these technologies allowed now, when patent terms expire, for more sustainable South-South cooperation on new innovation models. There's, of course, a lot of conversation about strategies to promote transfer of technology and voluntary license that are inclusive of Brics countries, not only as countries that are in need of access, but also of countries that can increase innovation capacity. We see recent, for example, voluntary license on important HIV/AIDS prevention technologies that unfortunately excludes many countries in the LAC region, not only as an opportunity for access to more affordable generics, but also as an opportunity to regionally manufacture this technology. As far as we know from the terms that have been released, no producer from the region and no innovator from the region has been included. There is a space for South-South cooperation here in ensuring that these voluntary licenses, technology transfer agreements are more public health driven and more inclusive. There is also space to go beyond technology transfer and voluntary license and to explore co-creation of technology and co-creation of access with a different paradigm. We believe there's a space for technology and knowledge sharing, and as well as consolidating of demand for more sustainability for strategic technologies. And the third bucket shows other areas of potential collaboration on partnership. Some BRIC countries, including, of course, Brazil, has years of experience on developing multi-sectorial public policies that promote public health and economic development and industrial development. There's lessons learned in this experience that could be expanded and explored through the BRICS cooperation, through South-South cooperation. There is also strategic information and data that could be shared across South-South cooperation. As I mentioned, issues of pricing, issues of R&D costs, issues of manufacturing costs, intellectual property, and many other key data points that member states and partners need to take informed decisions could be shared in a more strategic way with South-South partnerships. And then there could be also pooling of financial resources and innovative mechanisms. Next slide. Please. We want to highlight one specific area of cooperation where we think there is a need for innovation as well as for access. And this is the issue of biosimilars. These slides shows you data from the region that tries to explain and gives you in one image the potential for price savings, but therefore increasing access and expanding coverage for the treatment of key health conditions, including non-communicable diseases, when we introduce biosimilars in 5 innovative medicines in the region. You can see an average of 30%, close to 40% of price reductions, and this you compare the price of the brand name biologic next to the biosimilar that has been introduced when it's possible according to laws and policies on the specific country. We believe that this market is extremely concentrated, the market of biosimilars, and there is a strong potential for competition, strong potential for increasing innovation, as well as access on key innovation and innovative platforms that could transform how we prevent, diagnose, and treat a broad variety of conditions beyond the 5 that I'm currently mentioning here. So this is an area that we would like to highlight as an area of future potential and stronger collaboration among BRICS. And then the final slide, if I may. I know I've been talking a lot, and I know there is a lot of time. We want to have time for discussions and questions. So if I might move to the next slide, is a snapshot of key suggestions or opportunities that we see for South-South cooperation. First, promote South-South cooperation in R&D and production of strategic health technologies, create enabling environments for that cooperation, and create concrete partnerships on concrete projects and technology. I think this is really linked to the proposal that the Brazilian government has put forward in the G20 on really, we know that cooperation exists, we know that South-South cooperation is happening, but there is a space for growing of that South-South cooperation and that North and South cooperation. That it can be done in multiple ways, but promoting concrete cooperation for specific projects and specific technologies that are of regional and global interest is a very important way of starting. We know there are discussions at the G20 right now about dengue, for example. We think this is a huge priority for our region, and we will be happy to support exploration of cooperation, BRICS and South-South, as well as North-South cooperation, and how to promote more innovation, production, and access to dengue technologies as an example of strategic health technologies. Pool or coordinate investments. As I mentioned, most of the investments on research and development and innovation are happening in G20 countries, in G20 member states. However, most of that investment is sometimes uncoordinated, is sometimes done at a national, country by country, project by project basics. We believe that by pooling or coordinating investments, including especially among BRIC countries and BRIC stakeholders, could really transform the way we do innovation and improve efficiencies, but also improve reach of our interventions, including, for example, multi-country clinical trials, and ensuring that that investment not only increases innovation, but also increases access. We are following with a strong attention the negotiations that are happening right now at the WHO on a pandemic treaty, where member states, including many Brics member states, are proposing access conditionalities connected to R&D funding and purchasing agreements. We believe this is an important endeavor, and independently of the agreement, the final agreement at WHO on the pandemic agreement, we believe there is a space for South-South cooperation, including in Brics countries, on sharing models, sharing experiences, and promoting that access conditionalities to R&D funding as a different paradigm that gives more power to public spending and ensures a broader public return of that public investment on R&D. Then we see a variety of models on development and technology transfer being pursued by Brics member states and partners. We believe there is room for improvement and ensure that these technology transfer models and agreements are more public health oriented, including changes in some of the terms that are being included in these agreements and exploring of mechanisms that promote open innovation and open science. Finally, Brics countries have, as member states and Brics partners, including academia, public and private sector, a strong role to play on supporting the development of national and global enabling ecosystems. These, of course, require multi-sectorial and coherent policies, as I mentioned, strengthening regulatory systems, as well as human resources and consolidation of demands and markets. The ecosystems is as important as the specific technology, because even if we develop important projects and important cooperation on the development of one technology or one product, that technology of that product will not be able to fulfill the public health systems of countries and populations if they're not accompanied by investments on these ecosystems that ensure that the technologies are in fact available, affordable, and of quality when populations and countries need them. And then increased transparency and sharing of access to strategic information. Bric countries, partners, academia, and partners have access to very strategic information within South-South cooperation on sharing that information and sharing that ecosystem of data that is needed to take informed decisions is a key strategy and a key opportunity for collaboration. That's all from my side. I hope this was helpful. I want to thank again the organizers for inviting the Pan American Health Organization for sharing our mandate as well as our experience in promoting access, innovation, and production of health technologies for the public benefit.
Thank you. Thank you very much, Judith. You brought WHO to our region. You brought everything that WHO is doing here in our region, the importance, the relevance of cooperation between countries, and of technical support that PAHO provides to countries in several issues, in regulation, in production, capacity building, and also the special program on innovation. And you highlighted very much the importance of partnerships, the technology capacity, and the dependence on the region. When we hear you saying that 93% of the G20 countries are responsible for production, then the importance of the Brazilian proposal in the G20 is most relevant. When they proposed, and we will have a meeting of ministers of health in 2 more weeks here in Rio. So for sure, this global alliance for regional production and innovation will come to discussion. And of course, we see your last slide as a way forward, very clearly delineated, very clearly said, this is what we need to do, and this is what we can do, this is what we are proposing to do, and let's do it together. So I think it was very, very well. I will pass immediately to Sergio, and at the end we will have a time for questions from the audience and for comments, questions, or areas that we hope that you can stay more with us. We know that you have other commitments today, and in Washington you will have to leave at some time for a meeting. We know that Aparna also was very very called to several commitments today. But we hope that we can still have room for debate before we break for lunch. So immediately I would pass to Sergio Sosestani, our regional director for our Latin America director for DNDi, an epidemiologist, medical doctor, and that's working very hard on neglected tropical diseases, and now leading what we are doing in several countries here in Latin America and the Caribbean. So Sergio, the floor is yours. And we will have no technological problem now with you. Okay?
Bom dia e muito obrigado.
Good morning. Thank you for the instructions.
Tem uma versão em inglês e tem que ser compartilhado com.
exatamente no tempo certo do cronograma do seminário. Faltam 2 minutos para começar a série de perguntas, comentários, etc. Então, nós cumprimos, apesar dos problemas tecnológicos, todo o horário. E, para mim, eu fico muito satisfeito, assim, mas satisfeito demais, Sérgio, de ouvir você, porque eu vivi D&D desde o início. Eu fui parte do D&D Working Group, que foi montado com recursos do Prêmio Nobel dos Médicos Sem Fronteira.
The Nobel Prize that we worked for 2 or 3 years. So we had an initiative of the Interactive Disease Initiatives. And we see in your work as we migrate from neglected diseases for neglected populations. And this is a wider way in a proper manner. And we see Fuchers as a member since the beginning, working and representing them. And I am here on behalf of the DNA in Geneva and Latin American, and I think that we have already seen that it's very more than over 20 years we reached a lot, and beyond what we got, we have the model. And besides what we got the medal, and we got this Nagart B partnership concerning antibiotics because of the lack of new antibiotics. So we've been fulfilling this alliance thing is very wide and concrete based. So I thank Sergio for your great presentation. Remember what D&A is doing and what we'll do. So then we have the room for comments. Unfortunately, Judith is no longer here because she has another meeting. So anyway, we are available. I don't know that if from India we have any link or they gave up because of the time, because we cannot require that they stay until midnight, 1 a.m. in their origin country because of the time, because we had problems here. So these problems of the global system, these schedules, they actually can create some problem. But technology could not hinder us from having the 3 presentations, and we saw the 3 slides of the 3 presentation, and that now we have time for comments in general, but we have concerning 1 hour of work, so we are open. I don't know whether someone from the organization commission can inform the best way to perform the debate. If we can. Okay, alright, Ning is gonna tell us. I'm sorry, but the Kevin has no access to the microphone. So there will be a microphone going around here, and let's see whether it is going to be a comment or a direct question to one of the presentations.
So we ask each one of you to speak. When you're going to speak, please identify yourselves, who you are, your name, your institution, and then your comments. I'm Vera Luisa, researcher from NAF INSP. I am at the doctorate level, and I have taken part in this commission for the organization of this event. So I will just check my notes here, but I think it's useful to discuss. So since I am one of the rapporteurs, I noted that we have some of the issues for research that we have to strengthen in order to strengthen the topics that we are discussing here today. So one of them would be the challenges to strengthen the capacity for research and innovation. and I know that I owe Sergio an answer here, but I think that the other presentations have been creating other questions that came up. So it seems to me that the challenge of affordability is interesting in India. So I understand that they have a limit amount for each payment. So for the region of the Americas, on the other hand, we have the possibilities of cooperation that came up in Judith lecture. So I'd like to know more about the central issues that scientific research could help clarify in order to strengthen the research and development. Well, let's have at least 3 questions, and then Sergio is going to answer, and I will try and help as well. Good morning, my name is Daniela Molan. I work with Vera, George, and Lanafe. So the presentations have been excellent, and they make us think about, especially Judith talked about the issue of South-South cooperation, and we have been discussing that in different fora. So we have been talking about regional policies for innovation. So I'd like to, it's a shame that Judith has left, but I would like to, if possible, hear from both of you, because she mentioned some issues for those corporations, such as the research and development financing cooperation in multiple countries, and the cooperation also involving research and development in different countries. So I'd like to hear a little bit more about this. How could this be possible? Because this is something we know the countries have different cultures for, and different health systems, and different means for financing, and also different technological capacities. So how could we coordinate? Because coordination also involves effort, and even Sergio mentioned that one of the issues is really how to coordinate, and how could we do that for a cooperation towards perhaps a plan for innovation in health on Brics, or maybe something like that. Thanks. Good morning, thank you. I'm Adriana Mendoza from NAFE, and in regards to some of the comments that we had precisely regarding the topic of the limited capacity for R&D, and a little bit of what has been said by our previous colleagues. As for the presentation of the Pajo Regional Office, Judith has shown not like 93% of the capacities would be in G20 countries, and some of the G20 countries. And I think this seminar is very interesting in having this perspective, including the BRICS countries, but also looking at the agenda of the Americas. So it's just interesting to add that in terms of those issues, because I think it would be interesting to have those strategies for research, and to study the experiences of each country, and also the capacities the institutional capacities that they might have. So I think it's interesting to hear from you a little bit about the strategies that we could consider. So I think here we have Rio as headquarters for the G20 meeting in November, and of course we could have a strategy of how to document and how to follow those procedures, considering that this seminary is right in the down of this meeting for in Russia, of course, but also here we will have G20, and we have to be aware of that. So I would like to hear more about that. Well, tomorrow, unfortunately, we don't have Half here. He will come this afternoon. But we have here at UERJ, we have been speaking about that. We do have an interest in working and not only R&D, but also in this very sensitive area, which is the human resources and training. So I would like to mention this again, considering UERJ, of course, that was the request. And I think it's very interesting that we have this preoccupation. I think it's a great concern that on Monday, visiting Bilman with Cristina Lara from the Ministry of Health of Cuba, we have seen very many possibilities of cooperation from the standpoint of the countries in both the Caribbean and Latin America. So I'd like to just express that concern on behalf of UERJ, because that would be an addition to what you just mentioned. So let's reply, and then we can have a new round of questions. Thanks. I'll be very brief here for this intervention. So, what are the needs that we have for research? So, for any development or any demand, any priorities. So, the priority is to see the different complexities, and they are happening in the national level and the regional level, and of course in the global level. So it's a huge challenge on how to prioritize in all of those levels, and we have many mechanisms through which the governments might decide, and for each topic that we are mentioning, Ministry of Health and Science, they would be key in defining methodologies for that and for all of those levels, and those are the ones that would demand the requirements for scientific development. We have a particularity in Brazil, that is the plurality and opening, and how that involves different stakeholders in the sector, in the public sector, and all of the stakeholders in the country in order to make decisions. So that has its own complexities and also a very difficult legitimacy that is hard to break and convert. So this is something that we should value and take advantage of. So we have words that are kind of magic words, and they are getting everybody on board in terms of local access and equitable access. So those 4 words will show up very quickly, and the WHO is involved in this very fundamental role that it plays. Even PAHO, that is older than the WHO as a whole, and it's a regional player, it's also dedicated to that. And also G20, considering those are countries that have secretariats in the WHO and PAHO, they're also discussing that alliance, and WHO is now diagnosing capacities for innovation, for production of new technologies for health. So PAHO, of course, is playing the same role in the region, and then the European Union, that has and used to have a focus in Africa. They are now developing a relationship between the EU, Latin America, and the Caribbean. So this is something that we are following up close, and this is I'm part of the advisory group, and we are also diagnosing in terms of capacity for innovation and regulation, so that the decisions of the EU can also be supported. And we also have another challenge here, since all of those references are pointing towards the same objective. They are converging in order to become efficient, and we have incidents of the decision making that should be properly managed. So the region of Brazil, and we also have in our perspective, even though this has been mentioned by Judith as well, we have a tremendous capacity for production, and we have a limited capacity to innovate. So those discrepancies are the ones that Brazil is putting a lot of effort into its remediation, of course, and in order to have a full capacity to innovate as well in the country. And two final points here: the role of the regulatory agencies, and it's a critical role, because it is, first you have to, you had the dream of finally we have a convergency because it's feasible. And after the pandemic, of course, it has been a challenge, and during the pandemic as well, so that has been producing some of the revolutions that we have seen, but it should be faster and more intense. But also the great challenge of intellectual property, which is important in any innovation process, and we are joining efforts in order to try and get to a convergent point. I agree with everything you said, Sergio, and we have seen in the pandemic agreement discussion, we have seen those differences between the countries in the north or the south. So we always see this problem of intellectual property. So we always have that. So that's why we have in the name of this seminar we have pharmaceutical policies in Brics Plus and possible proposals for Brazil. And that's why we knew it would go beyond the Brics countries, and we now have Latin America and the Caribbean, and that's what Pajo mentioned. And we also have D&D here in Latin America working, and we also have G20 in the Global Alliance in order to discuss that. And of course, they will be here in 2 weeks from now. And we also have Brics Plus, which includes other countries that joined and some others that might join in the future. They have potential for that. So one of the main flaws that I see that we have here is the inability to, or perhaps the difficulty of putting a relationship in place between the industry and the university. So we have a lot of research and we have a lot of innovation in the universities, but differently from what we have seen in the European and American universities, they will transfer research to the production level. And here we have faced difficulties in doing that, because we have the industry on one side and then the academics on the other side. So we have to advance further in helping universities play their fundamental role, and also the civil society, because civil society also has a fundamental role to play, and they have to support, and they have been working in that. But we have to bring this problem of intellectual property and the impossibility of having access and the prices that are unacceptable for certain products. And I use Zartana for heart hypertension and arterial hypertension. So you would see it's 97 reais, and the discount would be 87, and then it costs 10. If you have 90% of this in a discount, it's because you had an unmeasured profit in the beginning. So this is a common practice in Brazil, and we have medication that is in the maximum price, and the maximum price sometimes is just tagged as the limit, the upper limit, and that would be very hard to get to an accessible price. So affordability, making things accessible is fundamental, and we have a very important role to play as civil society and tackling this problem in order to have less intellectual property and also have more safety in ensuring that. So the new products that are coming into the market now will be problematic as well, because some of the high price products, I would say not high cost but high price, they would be essential in Brazil and in other countries as well. So for sure, those new procedures, when they get to the private sector, will also be in high demand. So we have to see how we can work with the legislation and with lawyers in order to go the opposite way, right, from what the industry is doing. So we could have the whole rationale ready in order to sue people if needed. So when that gets to the managers, of course, they will either comply or go to jail. So of course that would be an endless pit that we can get ourselves into. And what can we do? And well, what we can do is to bring the health system to bankruptcy. Even though it is very effective, it is the greatest public health system in the world, and that's something we have to consider when we speak about the Brics and Brics Plus and Latin America and the Caribbean, G20. We have to have all of those forward, but we have to feed them with the proposals that come from the global south, as we are doing here. But many times, it takes a stalemate would take 2 years to resolve, and sometimes you couldn't bring that to the World Health Organization. It might have to extend that for longer. So I think we have to consider all of those aspects in order to understand the complexity that we are dealing with in order to ensure access to those products. Because we can have production and then we can put that on the shelves for $2 million a product. Or we might have individual therapy and products that would cost, and they are being discussed now in Brazil. So we have to jump onto those new technologies in order to reduce the price of those technologies, of course. Anything else? I think Bermudez, Sergio also brought some things, but I'm just thinking aloud here for us to have a short overview of what we heard, and I think each one will remember what is most fitting. But I think India has been very impactful because she mentioned that the public lab experience, the whole process in India started with the public official labs, and they selected the essential medicines and the generic medicines as well. And I think that invites us to think that the neglected populations, as you have changed that term in a brilliant manner, we have to think about it, and we also have the absence of the state regulating. So she forced us to think not only through COVID, because COVID has been a scandal showing that difficulty, but the capacity of states to have that full mapping of local production and to have another setup of the health system, and also the need that we still have to rescue the essential medication issues. So we have a huge possibility of and I know that the rhetoric goes about innovation, of course, but in India, that caught my attention, the capacity to come up with human resources and also have human resources innovating and bringing new capacities for technology. And that gets my attention for our capacity in our health system to provide that. And it's not for nothing that we are one of the main developers in the clinical industry, and the industry sector likes that, and they need us to develop more. And I think that also brought an innovation that you mentioned, Sergio, that is important, because that relationship between this tripod of the development, management, and the whole process of following up with a huge industrial system by your side. And I think that was very interesting because, as Bermudez said, we have a couple of challenges. We have many challenges, and the Brazilian state is huge. And first of all, we have the institutional fragmentation we face, and the challenges in regulation, and the intersections that are difficult to make. So we perhaps could look at some partnerships and ideas that you brought, including that tripod. So that could bring some ideas of how's that relationship with the industry. We know that they have a lot of interest in producing new molecular entities. We shouldn't even talk about that. Everybody knows. But how is the relationship with NDI? I think it's interesting that you mentioned that. And those are provocations. This is just me thinking aloud. Okay, no question here. Just that.
Well, thanks for the comment. An issue that's got to do with this part. One of the great problems in the model is how we're going to use this instrument, different instruments, to go from one phase to the other. You can imagine you have one company that has all the components and models, and the other one that is for one phase. The instruments for the rights of the instrument in one area and this created some led us to some legals into the narrative and the rhetoric according to the issues related to these parts, not only considering this part but also involving the transfers from one to the other, and this is a rational and juridical part that has been moved to this, and it's an attribute that has to the model, and every time that we are able to share, I believe that it's gonna be able to exactly for these movements. Thank you all for the interventions. Thanks for the decades of collaborations, and we were able to develop the work that we call the qualities of the scientific techniques. So I think that is very punctual because you brought, as he said, Woods was right in the beginning of work of the DPI. Carlos Morel shifted that for some diseases during this work. So you brought basically two cases. One, well, among the medications, the molecules, the one that I studied, we have a lot of people here, and I was able to see that one of the things that was innovation for the group, and we were part of that. A best professional, Jaime Abbott, who worked with the Brazilian government for a long time. Brazil produced. We have pictures of Sofrigovir to 30x, where it's equal in terms of the intellectual area that we were able to copy, that we had an intermediary aspect. Well, the intellectual property is the core of everything. I would like to mention something funny. At that time, we had a headlight. I don't know if anyone was there. I believe Hello was there. It was a clandestine meeting with Farpadu King from Egypt exactly to propose a partnership. And that happened 10 years ago. So it's interesting to hear how that clever is there the rest for Manguinhos. So I think that the impression that we got is that it's as if we had learned something else. As you make me into in the north, we also have it in the south. I would like to know what that is because I haven't researched. Maybe even the flora in the manufacturer has new innovations. I know Brazil was prohibited to produce because of intellectual intelli- intelligence mitigants. You can remember all that. So this Hadascavi is an innovation of a group where Brazil is partner from the beginning with the innovators. So no one can come here and simply say that this is a copy or we disrespected the rules or whatever. But it's interesting because I didn't follow that though. How they developed that innovation. So anyway, it's not actually a question. If you could speak a little bit more how this project started, the main players, and we're gonna have some kind of license that is to go for the working mode. It's not the exclusion I mean, but it's the access. So it's a comment because I had the impression that we discovered a new way because this is different where we had all that. It could have been Brazilian. It was not because of mitigants in terms of the property. Good afternoon. I am Professor Rado. I am from the pharmaceutical part, and I'm also part of the clinical platform of Fiocruz presidency. We have an association with MDI, and I would like to hear a little bit more from Sergio about the challenges inside the NDI when we work with some problems. How do you think about the management of these problems, considering financing or creating the projects that are created for neglected diseases? What about these challenges, the priorities, the access? As you mentioned earlier, well, we have different realities from the access to treatment and the studies, and also Cesar, how DNI has worked with a clinical trial with human beings, how you have dealt with this challenge because we don't know what is ahead of us. We have no guidance what is going to be in the future and how the studies will be conducted for the new sort of medications available for the population. Oh, I don't see anybody else trying to comment, so it was a very fruitful morning in terms of discussion and informations and concrete proposals, understanding a little bit about the global our framework that we have, and I believe that we've reached the end of the session in this morning part, and I give the floor to the mediator so she can point out what we're gonna do. Okay, let me take a look here because I have everything written. Okay, we are going to end up rock pop this part in the morning. We're gonna be having a lunch for the brunch, and that we count on you, where we're going to have the political industries of Brics past and present, and we have the presence of Itamaraty, Ricardo Lucera, and the representative from Cuba, and we have the person from China, Wao Wei Shu, and the doctor of radio and pharmacy, Dr. Raft. So please come back in the afternoon. Have a good lunch.